Assalamualaikum warahmatullahi wabarakatuh. My name is Nazatul Hadira binti Hasimi and my metric number is DNS 07210033. We are from Group 10. We present about diphtheria. What is diphtheria? First, known to be an infection caused by corynal bacteria. Diphtheria is a serious infection caused by strain of bacteria called Corynebacterium diphtheria. Diphtheria bacteria spread from person to person, usually through respiratory droplets, like from coughing or sneezing. People can also get sick from touching infect open sores or ulcers. Second, make it a toxin. The bacteria most commonly infect your nose and throat. Once you're infected, the bacteria release dangerous substance called toxin in the body. Third, affect the mucous membrane. Diphtheria is a serious bacterial infection that affects the mucous membrane of the throat and nose. Fourth, vaccine is effective for prevention. A diphtheria vaccine is effective for prevention and available in a number of formulations. 3 or 4 doses given along with tetanus vaccine and pertussis vaccine. And the last one, it can cause self-damage if left untreated. If it's left untreated, it can cause self-damage to your kidneys, nervous system, heart, and most seriously can be fatal. That's all from me. Thank you.
And Assalamualaikum. My name is Siti Afro binti Said, DNS 07210079. Today, I want to present about types of microorganisms that cause the disease. My point number 1 is microorganisms that cause the disease are Corynebacterium diphtheria. Corynebacterium diphtheria is a facultative anaerobic organism. My point number 2, Corynebacterium diphtheria also classified into biotype, which is Metis, intermedius, and gravis. According to colony morphology, as well as into lysotype based upon Corynebacterium pH sensitivity. My point number 3 is these germs can spread through a variety of ways. For example, these germs are spread through physical contact, air, liquids, and contact with the diphtheria patient himself. The carriers of these germs are humans themselves, and they are very sensitive to environmental factors such as dryness, heat, and sunlight. My point number 4 is these germs are dangerous and cause death. These microorganisms mostly attack children, the elderly over the age of 60, and people with low antibodies because the recorded death rates from diphtheria are highest among infants and the elderly. And that usually occurs within 3 to 4 days. My last point is Corynebacterium diphtheria also cause many disorders and difficulties. Severe diphtheria will cause respiratory problems, nerve disorder, and heart damage. To avoid this disease, we must get immunization and vaccine. That's all from me. Thank you.
Assalamualaikum, my name is Nur Farisha Azuri binti Azlan. My number matrix is DNS 07210049. I would like to explain about microfication and general characteristic of microorganisms and their length and usefulness to human. Number 3. General characteristic of diphtheria are: number 1, non-motile rods; 2, gram-positive bacillus; 3, catalase positive; 4, aerobic facultative and aerobic; 5, non-sporoformic; and lastly size 0.3 micrometer to 1 micrometer in diameter and 1.0 micrometer to 8 micrometer length. Next, number 4, diphtheria can affect the respiratory tract and skin. Such as in the respiratory tract, it causes a thick gray coating to build up in the throat or nose. The coating can make it hard to breathe and swallow. Next, diphtheria skin infection can cause open sores or shallow ulcer. And then lastly, number 5, severe infection with diphtheria can lead to systemic involvement and can affect other organs short term as well, such as the heart. That's it from me.
Assalamualaikum warahmatullahi wabarakatuh. My name is Fortune Najah binti Roslan and my number matric is DNS 07210076. Today I will share about microbial classification and general characteristic of microorganisms and their link and usefulness to humans. Number 1, classify into biotypes such as metis, intermediates, and gravis. Number 2, most strains require nicotinic and photogenic acid. Number 3, 4, and 5, I will pass to Risha Izwani.
Assalamualaikum and hi, my name is Aina Nadira binti Abdul Wahab and my matric number is DNS 07210002. Now, I want to present about life cycle of the microorganism. First of all, I want to tell you about how microorganisms can breed of diphtheria. Diphtheria is a disease that affects the upper respiratory tract. Diphtheria is also derived from bacteria and can attack mucous membranes within 5 days. Then, the next point tell about among the places that are often infected are the perine and tonsils, while bacteria can also attack the tissue of the nose, larynx, and skin. Anterior nasal diphtheria is usually the same as the common cold because the location of the infection does not allow systematic absorption of diphtheria toxins. The next point is pharyngeal, tonsil, and laryngeal diphtheria is worse because more toxins are absorbed into the bloodstream and tonsils. Then, pseudomembrane is a network of fibrin that is infected by diphtheria cells and that grow on epithelial cells in the back of the throat. The symptom is a rash or ulcer on the skin. Then, I want to tell you about Caribacterium diphtheria is a gram-positive bacillus that is immobile and not encapsulated. Toxic strains are lysogenic to one of the families of Caribacteriophagus that carry structural genes for diphtheria and toxins. Caribacterium diphtheria is classified into biotypes, namely metis, intermediates, and gravis, as well lysotypes. Most strains require nicotinic acid and phytogenate for growth. In addition, biotin is also used for growth. For optimal production of diphtheria toxin, the medium should be supplemented with amino acids. The last point is diphtheria depends on how much toxin is absorbed into the bloodstream because the toxin have degenerative effect on the heart, nerves, muscle, liver, and kidneys. Patient will develop myocarditis or neuritis, which leads to heart failure. That's all from me. Now I will pass to next presenter.
Assalamualaikum and hi. Before I begin, let me introduce myself first. My name is Nur Alia Nadia binti Abdul Aziz and my metis number is DNS 07210046. Now, I would like to share with you about how the mode of transmission of diphtheria are infected. Like you can see, the first one is airborne droplets can infected through coughing or sneezing. The habit of infection often occurs because there is no distance of 1 meter from each other. Next transmission is direct contact, which is diphtheria can infected through touching open parts such as skin of people infected with scabies or ulcer, from the eyes, runny nasal, and others. We go to next part is contaminated premise, which is through contact with contaminated surface such as dirty air or objects such as things that are always touched by others like doorknobs, tables, and so on. The last one transmission of diphtheria is micro, which is through unpasteurized milk. Micro can carry harmful germs such as Brucella, Listeria, Salmonella, and others, which can pose serious health risks. Among the symptoms of diphtheria are: number 1 is low-grade fever in below 36.0. Number 2 is malaise and weakness. Number 3 is pharyngeal diphtheria. The part is sore throat, swollen neck we call bull neck, and pseudomembrane is difficulty breathing. Number 4 is myocarditis. The part is arrhythmias and heart failure due to heart can't pump enough blood to meet the body's demand. Number 5 is cutaneous diphtheria. The part is chronic skin ulcer. We call the name is swallow. Number 6 is acute tubular necrosis. The part is oliguria, which is low urine output. And the last one is oculomotor nerve palsy. And the part is diplopia, which is double visions and unable to move eyes to side, up, and down. That's all from me. Thank you.
Assalamualaikum, my name is Nisafira Kadina binti Deni. My matrix number is DNS 072100058. I will continue the next slide, which is treatment for diphtheria. The first treatment is antitoxin injection. Vein or muscle is the location of injection. The antitoxin injection is to counteract toxin that produced by bacteria called Corynebacterium. But before performing antitoxin injection, doctor may do skin allergy test to make sure that the infected person doesn't have an allergic to antitoxin injection. Next is antibiotic. This treatment to kill and get rid of bacteria in the body and also to clearing up infections. Example of the antibiotic given are penicillin and erythromycin. Lastly, doctor will run tests like swab the back of throat or nose. These tests to make sure the bacteria are not in the patient's body anymore. That's all from me. Thank you.
Assalamualaikum and hi, my name is Alisa Ainatira binti Zikri and my matric number is DNS07210005. Now, I would like to continue. The next slide is prevented for diphtheria. Diphtheria is one of the diseases that can be prevented with toxoid vaccine. This vaccine that stimulates the production of antibodies to diphtheria toxin. The most effective way to prevent diphtheria is give the toxin vaccine to people who see it early in their life and to prevent individuals from coming into close contact with uninfected people. For example, if travelers find themselves in the midst of a diphtheria epidemic, they should stay away from public areas. For example, cinemas, shopping complexes, and other areas with close contact. If you guys know, 2 persons who been infected is a carrier of the bacteria can be treated with antibiotic to eliminate the bacteria and thus reduce the chance of the carrier transmitting the bacteria to others. The toxoid vaccine may also contain cellular pertussis and tetanus. The side effects of the vaccine are usually mild, such as pain or soreness at the injection site and mild fever. The effect usually within a day. Thank you, that's all from me. Bye.
Assalamualaikum, my name is Nuzana Azila binti Azman, DNS 07210041. I will present about our summary. Number 1, diphtheria is one of the diseases that can disturb respiratory system. Second, the diphtheria is known as morbus sufficans or garitulo or suffocate in Spain. Diphtheria can spread via air exposed in infected wound and touch the infected item. The diphtheria not treated can destroy the heart, kidney, and nervous system. Last, the method to prevent diphtheria are take vaccine injection and multiply with other vaccine form such as DTP and additional injection. That's all from us. Thank you.